this computer. My name is Scott Simmons. I'm the pastor at Faith United Church of Christ on the south side of Indianapolis, and I'm here with my longtime friend, former college roommate from the University of Missouri, Dr. Alex Stinard. And Alex, about a month before the coronavirus hit, sent me a text message with a list of things to buy: masks, hand sanitizer. And it was really strange because, Alex, I've never experienced you to be a reactionary sort of person. And so I called you on the phone and you explained to me about the outbreak. I'd seen the news story, I think in China, but hadn't really read much about it. But you were really, really concerned before anybody I knew. Can you tell me about why that was and kind of what you knew back then?
Absolutely. So I'm an emergency medicine physician and I graduated med school about 15 years ago. And I practice at two different hospitals. I'm the chairman of the hospital for emergency medicine at both of those hospitals. One is one of three trauma centers in Orlando, and another one is affiliated with the university med school. And so I'm involved not only in the operations of the emergency department, but also county-wide operations for public health and education of residents and students in emergency medicine. So I'm pretty much aware of public health crisis because that's part of my planning, is planning for public health emergencies. So we planned for a plane crashing with 300 victims to a nuclear plant going and burning down. But we also plan every year for a pandemic. So we had a pandemic with the H1N1 flu strain several years ago. And that helped prepare our modeling for a respiratory virus that could be very dangerous. So when the SARS COVID-19 was starting to get worse in China, it had a lot of the telltale signs that it could be something that could affect not only China, but the whole world. So whenever we see a respiratory virus that can be spread between one individual to another and have a high rate of spread, then that can be something that can change the world. And we've seen that several times in history, just in the last 100 years.
And so you, in all your work and planning, saw all the signs of something pretty rough, and you started texting family and friends.
Well, my whole job in emergency medicine is preparedness. So not only are we preparing for an individual emergency for one patient, but we're planning to create a safety net for the whole society. So not only am I ready to treat that individual patient, but I'm trying to create a safety net for those large catastrophes. So I've been training my whole career for a pandemic.
Mm-hmm. So Florida has often had some of the worst levels of COVID, if I'm saying that correct, and you've been in the middle of it ever since the beginning. How can you just describe some of the experience in the ER and with your staff and just kind of what's been going on the ground level?
Well, I think with coronavirus, we've had, people call them waves, where we have surges or spikes in cases that get better and then get worse. We're currently in our fourth wave, or the fourth time that we've had a high number of coronavirus patients in our emergency department. I think a lot of that depends on how the mitigation strategies that are used are there to prevent disease. So we don't have a lot of good tools to treat coronavirus. We have a few medications, but they have not been proven to be highly effective. So the best ways that we can deal with coronavirus pandemic or infection is try to prevent. So the ways that we try to prevent infections, we used to have social distancing and masking and cleaning surfaces. We found that cleaning surfaces is not that effective because it's mostly a respiratory virus that's transmitted through the air. So we should focus pretty much all on respiratory precautions, meaning masking and distancing and good ventilation. We now have a vaccine that is highly effective to help prevent disease, but the new coronavirus with this fourth wave is so much more infectious that it infects everybody in the household that has not previously been infected or has had the vaccine. So I think it really does show that some of the decisions made by city, county, state national and even international organizations can have a big effect on how local transmission is occurring.
And it's really played out for you in the hospital, just seeing extra people come in. I mean, before the interview here, you were telling me kind of like some of the percentages of the hospital and the realities of that, with the beds filling up and people coming in for other preventable illnesses or things that could be treated, being in a very different situation than before.
So we're pretty lucky in Orlando to have such an extensive hospital network and ICU bed availability. We have some of the largest hospitals in the nation right here in Orlando, but Orlando has over 1.5 million people just in the primary center city, and we do not have any availability to do elective surgeries throughout the whole city. That means all three major hospital systems are not doing elective surgeries. That means if you have a breast cancer, you can't get that removed. If you need a pacemaker and you're not going unconscious, you're not going to get that pacemaker. We currently are using at our facility our cath lab recovery because we're not doing routine cardiac caths as an ICU for our trauma ICU. We currently have what we're using as our urgent care fast track in our emergency department as also an ICU. So we've had to convert places in our hospital into ICU beds, and then those ICU beds are not staffed the same way that we were before. And that's not just at my hospital, but that's at every hospital in Orlando.
Yeah, I remember when this was all beginning to happen. I was thinking about like some people I knew who were traveling down to Florida for vacation, and one of my concerns was, it's like, you know, if anything happens to you and you need to go to the hospital, the situation there is just way more complicated, way more dangerous, because you have a heart attack, your ability to get the kind of care you normally get is greatly reduced, almost eliminated in some cases. It's kind of what I'm hearing.
Yeah, if you look at our local news, which have been doing a good job of warning people about the coronavirus pandemic, they've put out just in the last 48 hours, each county chief of EMS is saying, don't call 911 unless it's an emergency, because not only are the emergency departments overwhelmed, but also the EMS system is.
Yeah. Yeah.
So that means that if you're in a car accident, you might not get to the hospital in that same period of time that you would have even a month ago before we had this surge in patients.
Yeah. Yeah. So, I mean, this, I think, kind of touches on a little bit of this idea that, like, hey, wearing a mask or getting the vaccine is a personal choice. That, you know, it's between me and my family. It's none of your business. Do you see it that way, or how do you see that issue?
I think that everybody should have a personal choice on if they're going to do a treatment or not. So if I'm in the hospital, I feel that people do have the autonomy to decide their own decisions. So let's say that you have to get your appendix out because you have appendicitis. You have the right to decide not to get your appendix out, but you need to be aware of those risks. Certainly with the vaccine, it's a little more complicated because the vaccine has been proven to decrease your likelihood of spreading coronavirus, certainly has decreased your risk of getting sick seriously with coronavirus, and it decreased your risk of dying. So a lot of that, meaning getting seriously sick or dying, has to do with you, but the fact that it can decrease your chance of spreading the disease, that helps other people.
Yeah. I mean, I guess I've thought about that there's other health measures that we are required to do or consent to do. Like, you know, you could say the speed limit is a public health measure, and we're not allowed to drive beyond a certain, you know, mile per hour because it becomes dangerous, not just for ourselves, but for everybody else. And I think it's really difficult territory, but you know, I see people lifting up, hey, this is a matter of personal freedom. And I think, well, you know, freedom for who, and what does that impact on everybody else? And I guess from your point of view, just being in the hospital, you see how those choices to exercise that personal freedom actually impinge on the freedom and well-being everybody else?
I think that, if you get the vaccine or you choose not to get the vaccine, let's say you choose not to get the vaccine, that's okay because that's a choice that you're making for yourself. But I do not see those same people saying that I'm going to wear a mask every time I'm around somebody else who's not in my household. So if you choose not to get the vaccine, I think that you should also make the decision that you should wear a mask when you're around anybody not in your own household, because you could be spreading that disease. And that's how the disease is spread, meaning through breathing, coughing, and talking.
Mhm. Why do you think people are reluctant to get the vaccine?
I think there's a lot of reasons. I think that not everybody has the information to know that the vaccine is safe. It doesn't change your DNA. It doesn't affect your infertility. There were years of science that went behind making the vaccine. I think likely the person who made the vaccine will get a Nobel Prize because it took years and years and some of the most complicated computers to make it happen. So we did not have the capability to make this vaccine 20 years ago because we did not have the ability to have the computers to make the vaccine. Before, we were growing vaccine in eggs, and it was not as scientific with computers to be so targeted.
I think that that's one thing that I didn't understand about the vaccine is that the particular vaccine for COVID is actually built off of an earlier technology. Is that, can you talk about that?
Absolutely. So Watson and Crick helped encode and helped us figure out what DNA was, what RNA was. And we understand the building blocks of life, meaning the DNA and the proteins that are made. So now we can use a computer to directly make it so your body makes the exact protein to fight a virus. So we are doing highly targeted vaccines now. We were not able to do that 20 years ago. So with the advent of DNA and supercomputers, we're able to now implement that technology to save lives.
And has there been a case of a vaccine like this coming onto market, being used and having to be pulled off or causing all sorts of issues in the long run?
I can tell you personally and through my colleagues, we have more than 50% of our patients in the hospital have coronavirus. We have never admitted somebody to my hospital with a side effect from the virus.
Hmm. So just from your point of view, the risk of coronavirus is so much greater.
Absolutely. And the risk of the vaccine is way less than a 1 in 100,000. And those risks, we know what the risks are now.
If you were to approach somebody who is afraid to take the vaccine or just kind of resistant to it, whatever it might be, they've decided not to take it, how would you approach that conversation? What might you ask or say to them?
I think the best way to approach somebody who is hesitant to take the vaccine is to be a caring individual, ask them questions about what their concerns are, and ask them if they need more information. So just engaging the person and treating them with compassion on why they're making that decision is really important. So I don't think you're going to change any minds by being judgmental, but trying to really engage somebody and figure out why, and if they have any questions, is the best approach in my opinion.
So thank you. I think that's dead on. I was wondering if the way the coronavirus is played out, from all the waves, the overrun of the hospitals, political climate, resistance to vaccines, masks, like kind of the whole shebang, is this surprising to you?
I'm pretty surprised because most things in medicine, people don't try to become the expert on. So if you're having heart attacks or strokes, you don't try to become the expert in cardiovascular disease or neuroimaging. You rely on your doctors to help you make those decisions. I think that the way with coronavirus has been tied into changing society, different rules being implied, different suggestions made by government, and everybody has an opinion, that people are deciding that they want to be the expert or they need to be the expert. I think that there are very few things in medicine that people try to become the expert and don't rely on their doctor to make their decisions for them.
Mhm.
99% of the time, when a patient comes into me in the emergency department, they are okay with whatever decision I make. If the patient is coming in with coronavirus, there's a high likelihood that it will not be 99% that that patient will agree with my treatments.
Yeah, sorry to chuckle. I just imagined like questioning you on your procedure to deal with like my car accident injuries and be like, hold on a second, it's like you're never going to, right? And but this is different.
I could see how people would feel the way that they want to be empowered with information because of how coronavirus has changed not only their life at their home, their life with their community, and their ability to do things that they really love and enjoy. So having that information, I think, empowers people, but it's difficult to get the correct information. And that's why going to medical school or having training in medicine certainly is an advantage in a public health crisis. And sometimes some of the people giving out the information are not giving out the information that is best for that individual.
There is this sense that the CDC and Dr. Fauci and kind of all the like figureheads of the COVID response have not given out consistent information or given out misinformation and therefore can't be trusted. I've spoken to people that feel that way. They said no mask, now mask, that this, that, whatever. What's your take on that?
I totally agree with them. I think that if the government should have started with saying that, similar to after 9/11, we went to a threat level. We started with red, yellow, green, and then eventually the threat level was taken away because we got used to having increased screening at the airports. So coronavirus is kind of like the threat level from terrorists, in my opinion, meaning that it can change from time to time because the virus will change. I think rather than trying to re-educate the public every time there's a new quote unquote mutation or the virus changes for these very scientific reasons and changes how we have to adapt with our mitigation strategies, that it'd be easier to just say that we need to be red in this community because we are worried about increased spread. So we need to put our masks back on and social distance and not gather indoors. This will not last forever. And then when we get the level down, we can go to yellow. Rather than trying to re-educate everybody in the United States to be an epidemiologist or infectious disease expert, I think it's better to just give people clear-cut guidelines that say, we feel as a public health community that we have bad spread, we need to use our tools.
And you don't feel like that happened in the beginning?
I don't think so. I think that there was a lot of communication that wasn't, things are going to change and people will use sound bites from previous interviews or articles and say, why are you changing this? Well, the facts have changed because this is not a well-studied disease. We've studied a lot now, but it's changing every day.
Mm-hmm. I guess that's kind of my response is like, look, they weren't really sure what they were dealing with at first. And as the science has evolved, what is being said has evolved. And that's actually to be expected.
Yes, absolutely. If you think about 20 years ago, we didn't even know how to isolate the cold virus, SARS-CoV.
Yeah.
And now we're able to not only sequence all the different types of SARS-CoV, but we're able to make a targeted vaccine for that. I mean, that's pretty amazing.
Mm-hmm. I mean, wasn't it though, like, weren't certain communities of medical professionals, experts on this sort of thing, saying, hey, we need to shut down, we need to social distance right at the get-go?
Absolutely. I think that there were some people in public health or infectious disease that were more cautious, and the information that they had was not complete, but they were saying that we should be very concerned. I think that those concerns of using our mitigation strategies have proven to be correct on decreasing the spread of disease. But I do feel that with wide implementation of the vaccine and more therapeutics coming online, that we will not be in this coronavirus pandemic forever.
Yeah, what do you see the next 6 to 12 months looking like?
I think that we will have localized areas where we will have surges, meaning that the virus will be at higher spread in some communities, and we'll likely need to have some more targeted mitigation. When I say targeted mitigation, I mean simple things: wear a mask, try not to gather indoors, and social distance. And if you're sick, stay home from work or school.
Mhm.
Those will need to be done more, and in some communities, but that will not need to be done in the whole United States.
In your state, the governor is putting pressure in a variety of ways to keep school boards from requiring masks. Um, how do you feel about that? Is that something happening in your local community?
My local community has actually put a mask mandate in to defy the governor, and most of the counties in Orlando have also put in that same mandate. I do feel that I agree with the American Academy of Pediatrics that children should be masked in school. So I go with the doctors with their decisions. And there are certainly doctors that are doctors in kids, meaning pediatrics, and then there's just doctors in community health. There's doctors in infectious disease. So we have specialized doctors for each one of these specialties, and every one of those specialties state that children should wear a mask in school currently.
Mhm. How has this pandemic changed you? Having to be, I mean, you're like a responsible person for this. I mean, right? Like for real, you're responsible for this community and disaster planning and all these sorts of things. And so, I mean, I think the pandemic has changed all of us in some ways personally, but you've carried a special load.
Well, I think it's given me a new appreciation for my family. Spending the time home has been a blessing. And I also really value the relationships that I have with those individuals at work. And I know that the small differences that we make every day when we see a patient are really changing lives, but also changing the system to be safer and make people feel more comfortable at work, feel safer at work, and provide better care. We can not only just affect one person. When I say we, my team, we can help the whole community. And I feel really blessed that I can do that.
Yeah. Yeah. Well, Alex, I think of you every time I read a story from Florida. I'm thrilled about that, and know that you're down there using all your intelligence and your big heart to try to do the best you can. And I've just been praying for you, and glad to get to talk to you about this and share you with my church community. I occasionally, I think I've stopped doing this mostly, but occasionally will send Alex a picture of some sort of ailment my kids have and ask his opinion, which I think is probably a burden of your job. So, any last thoughts that you would share to my community?
Well, I would just tell people that we're not going to be in this forever. And there are things that we can do to make it better. And I just think that if we just pull together as a community, that we're gonna get through this, and life's not gonna be this bad, meaning we're gonna not have to deal with this coronavirus pandemic forever, and things will get back to normal. But the faster that we make these personal changes, the faster we'll get back to normal.
Yeah, cool. Well, I'm going to end the interview, and then you and I can debrief off camera.
All right.